Okay, now that you understand what GLP medications do, let's talk about how to use them safely and effectively. In this program, we primarily use the injectable forms of these medications. That's because the injections provide the most accurate and consistent delivery. They bypass first pass metabolism of the liver, which means the medication reaches your bloodstream at the therapeutic level intended. In my experience, oral forms don't deliver the same results. They're often broken down during digestion and they may not be as effective. So if you're using an injectable, and most of you are, you're using the form that's the highest clinical benefit for metabolic improvement. Now, let's make sure you're using it correctly. Most injectables come as either a pre-filled pen or a vial and a syringe. Whichever format you're using, proper technique and consistency is what matters. Here are a few best practices. First, rotate your injection sites. Use the lower abdomen, outer thigh, or back of the arm. Avoid using the same spot over and over. Rotating helps prevent irritation, soreness, and tissue buildup. Always use a clean needle. Never reuse. A fresh needle reduces pain, protects the skin, and ensures proper delivery. Number 3, inject into the fatty layer under the skin, not into the muscle. Insert the needle at a 90-degree angle and inject slowly and steadily. Number 4, stick to your schedule. Most of these medications are taken once weekly. Pick a day that works best for you. Set a reminder and stay consistent. If you miss a dose, don't double up. Just follow the instructions provided or reach out for guidance. So let's talk storage. Injectable GLP medications should be refrigerated when not in use, ideally between 36 to 46 degrees in Fahrenheit. But don't worry if your medication isn't ice cold when it arrives in the mail, or if it's out for a few hours while you're traveling. Most versions are stable at room temperature for up to 28 days. That means a short time outside the fridge during shipping or a flight or a busy day, it's not going to make it unsafe or ineffective. Just avoid extremes. Don't leave it out in a hot car, direct sun, or in freezing conditions. When you can, store it in a cooler bag when traveling, but if you can't, just refrigerate it again once you get the chance. No need to panic, just treat it with care and consistency. One last piece on dosing. More is not better. Starting too high or increasing too quickly is the biggest reason people experience nausea, fatigue, bloating, or GI discomfort. That's why we take a start low and go slow approach. We use the lowest effective dose and give your body time to adjust. This is also why I prefer to use a vial and syringe instead of the pre-filled brand name pens. We can titrate and individualize the dose. Remember, we're not rushing for weight loss. We're supporting metabolic healing. And if you're unsure about anything, just reach out. If side effects show up, we can usually make small tweaks to help your body adjust more comfortably. You don't have to figure this out alone. If side effects show up, we can usually make small tweaks to help your body adjust more comfortably. You don't have to figure this out alone. Your next action step is to just write down any questions or concerns you have, if you have any, and bring them into our next coaching session. The more confidently you use this tool, the more benefits you'll get from it, and the more empowered you'll feel throughout this journey. So let's keep going.